My name is Ty, and I'll be doing the IV push medication skills today, the primary and secondary skills. So I'm going to sanitize and get on the MAR. And for the client, what's next up for the client, it is ondansetron 4 milligrams. And I'll do my calculations before I give the medications. And it is also sodium chloride, 125 mLs per hour, and the ciprofloxacin, which is 400 milligrams for over 200 milliliters. Okay. First, I'm going to check the very important things, allergies here, and right before I administer to the client, and then the rights, right medication, right person, right time, right dose, right route, right to refuse, right to document, and again, allergies. And I'm going to do it here when I'm gathering my supplies and right before I am administering to the client, right? For the ondansetron, the side effects are the headache, dizziness, and constipation. Considerations are hypersensitivity to the medication, and also liver disease. For the sodium chloride, you're going to want to assess the site before you administer the medication, and consider other considerations: fluid overload, side effects for fluid overload, and electrolyte imbalance. For the ciprofloxacin, the side effects are nausea, dizziness, headaches, and photosensitivity, and the side effects are hypersensitivity to the medication, and also people who are breastfeeding or are pregnant, the benefits have to outweigh the risks. Okay, so I'm going to hold my medication right now. I'm going to sanitize, hold my medication, and I'm going to check my medications. I have the Zofran 4 milligrams, okay? We'll go through over the calculations. I also have the ciprofloxacin, and I also have the normal saline. So I'm going to hand sanitize and put on gloves. And for each medication, I'm going to check for the color, the clarity, the consistency, expiration date, the right medication, and the right dose. All that is important for each medication, right? So now I'm going to pull my medication, and so I'm going to start with the ondansetron, which is with the IV push. I'm going to withdraw more than 2 milliliters of air. Okay. I'm going to inject air into air. Push air out. I'm going to tap the bubbles, tap all of the bubbles. I'm going to withdraw a little more than 2 milliliters, and then I'm going to tap again for bubbles, shoot out a little extra if there's air bubbles. I'm going to recap this. Okay, I'm going to label my medication, each of the medication, right? So the drug, the additive, the amount, who added it, which is me, the date, expiration date, and time. Okay, I'm going to label that. I'll label these bags when I hang it up. Okay, and there's some tubing labels that I'm going to want to go over. We're going to want to change the tubing every 72 hours. Okay, and then I'm going to prepare my flush. Okay. All right, so I'm ready to pull the medication. I'm going to sanitize, pull the I gather my supplies. Knock, knock. And
Hello.
hi, my name is Ty, and I will be your nurse today. Can I have your full name and birthday, please?
Yeah, Urena Tract, 9999.
Thank you. And I'm also going to double confirm. I'm going to confirm her wristband and confirm each medication to see if it was the right patient. But before I do that, I'm going to check precautions, and then I'm also going to provide privacy. Move the bed to the correct height, okay? And so I've performed, I've checked the medication. It is her. Do you have any allergies today? Any medication?
Yeah, the only thing I know of is mangoes.
Okay, great, mangoes. We don't have any mangoes today, but the medication. So I'm gonna assess the site before I get a medication for phlebitis, which is redness at the site or warmth, hot, and then I'm also going to assess the site for infiltration, which is leakage, coolness around the area. So I'm assessing the site, hand sanitized, and I'm assessing the site. Okay, it seems like it's good. So I'm going to flush my medication. Okay. And again, this was supposed to have a green cap on it, so we're gonna pretend that it's there's a green cap on it. So I'm going to scrub the hub for 15 seconds, let it dry for 5, and I'm going to unlock this, and I'm gonna flush it. Okay, now it's flushing, so it's patent. Okay, so now I'm going to get my medication ready, and then I would uncap this. Okay, and I'm going to put this here. I'm going to, again, just to make sure, you know, I'm gonna scrub the hub again for 15 seconds, let it dry for 5. Okay, depending on the facility, each facility is different. And I'm going to connect the medication. Okay, I'm going to push the medications over 2 minutes, okay? And I'm gonna lightly tap it, you know, and again, I would check for patency earlier, and I did. Patency was fine. It was for 2 minutes. Okay, we're gonna pretend that there's a cap, so I'm gonna cap this. Okay, and then now I'm going to flush it again. Okay, so I'm gonna uncap this, scrub it for 5, and ideally I would wait 2 minutes before after the medication administration. I would scrub it for 15 seconds, and let it dry for 5, and then I'm gonna connect it again. And ideally, you want to flush the first milliliter at the same rate as the medication, and it is flushed at the same rate for the medication. And again, I am going to lock it. Okay, we'll pretend that that is a cap. I apologize, we're using old equipment. We're running out of equipment. Okay, are you feeling any pain?
No, I feel okay.
Okay, so we're checking again for leakage, for phlebitis, and anything else. And depending on your facility, I would change gloves again, sanitize. Okay, so before I start this, I'm going to talk about our calculations. We're going to get the sodium chloride, 125 milliliters an hour. It's about 7 drops per 20 seconds. And the ciprofloxacin, we're going to give 44 drops per 20 seconds. Maximum dose is 400 milligrams per 12 hours. And there was a discrepancy, but with the ondansetron, 4 milligrams was either 8 or 12 hours. And so you would make sure that which one it was for the maximum dosage. Okay, so now I'm going to open my primary bag, checking against right medication, right flow rate, color, clarity. Okay. Again, I'm going to do this with, but before I do that, I can set that aside. The caps are still there, still sterile. I'm going to undo the tubing here, making sure it's not touching, anything. The bed or the floor, we want it as sterile as possible. Okay, and it has both the caps on there. Okay, so now again, I check the medication clarity, expiration date for all 3, which is the most important thing. Now I'm going to properly open this and spike it without contaminating the port. Right there, right there. Sorry. So without contaminating the port, okay? Okay, so there we go. So I'm gonna, all right, it is in. I'm gonna bring this all the way up, make sure it's closed. Squeeze the chamber halfway. Okay. All right, and this is still closed, and I'm gonna prime it. So now I'm gonna prime it. So, all right, you can try prime it over a trash can, and it's set. Okay, so I'm gonna lock it again. I'm gonna lock it. So, and again, I'm going to open the port, scrub for 15 seconds, let it dry for 5. Okay, undo this cap. Okay, now I'm gonna carefully connect the port. All right, so it is connected. Now, again, what we talked about earlier is 7 drops per 20 seconds. So I'm gonna titrate it 27 drops for 20 seconds. Okay. All right, that's 7 drops for 20 seconds. We leave the line there. And then I'm gonna take off my gloves, sanitize, and do the and put on new gloves for the secondary bag. Again, I'm gonna open this, check right medication, dose, right flow rate, and so I'm gonna open the tubing again, and it's the same thing as the last time where, you know, I'm trying to open this as sterile possible. The caps are still on. Okay, so now I'm going to unplug this. All right, now I'm going to plug this in with this twisting motion, and it's in. And again, you know, making sure that this is locked, okay? So making sure that this is locked, okay? And a lot of these old tubing, they've been leaking. All right, so now I'm also going to, for the calculation for this, I'll show you. Okay. So for the tubing, you know, I forgot before the tubing, I need to provide client education, and for the Ondansetron, I was you know, is for nausea, vomiting, and for the normal so it helped with your nausea, vomiting. For the normal saline, it would be for fluid balance, and for the ciprofloxacin, because you've been having a UTI, this is antibiotics. Okay, so now we explained the flow rate for the sodium chloride. Now the flow rate for the ciprofloxacin is 44 drops per 20 seconds. Okay, so again, I'm gonna take this. Okay. So I would scrub the hub for 15 seconds, let it dry for 5, and I made sure earlier that it's locked so we don't waste any medication. Okay. And I'm gonna connect this. All right. Okay, so it's connected. Okay, so now I'm gonna back prime this. And squeeze the chamber halfway also, like the other one. Okay, now I'm gonna back prime it. And again, making sure there's no air bubbles for this one also, just like the primary. I'm making sure there's no air bubbles. But also I need to unlock this so we can back prime it. So we'll unlock this. And there we go. And there we go. It's flowing in. All right. So I'm gonna lock this again. I'm gonna lower. I'm gonna lower the secondary bag, and please forgive me because this is old material. I'm gonna get this piece. I'm gonna lower the secondary bag. All right, so.
I'm just doing this a bit more because I've been taking a bunch of times in the past, so I'm just being really thorough.
Okay, so now that we lower the second bag, I'm gonna titrate the secondary tubing to 44 drops per 20 seconds. All right. And again, you know, this is old tubing, so it would be dropping at 44 seconds per 20 second. So, because this is flowing, okay, so great. It's 44 seconds, 44 drops per 20 seconds. All right. So, how are you feeling? Are you
Feeling okay, yeah.
Yeah. Okay. So I'll check back in a bit with the ciprofloxacin because you know if you have a reaction, you'll have a rash or hard to breathe, and so I'll check back. Can I get you anything right now?
No, I'm okay.
No.
Thank you.
Okay. And then I would also put a tag on the tubing, my initials, the start, when to discard it, and it should be changed every 72 hours. Same thing with the medications, right? My initials, the expiration date, the medication, the dosage, the flow rate, the date, the time, and all that. Okay, and so I asked if the client needed anything. I'm gonna lower the bed, the call light, make sure the rails are up for safety, and I'm gonna check back in 15 minutes. But before that, I would hand sanitize, and I'm gonna document like how they took the medication, if there was any phlebitis that we checked before we give them medication, how the site was, you know. But I already said that we check the site before we administer the medication, if how you know how the skin was looking, the medication, the date, the expiration date, and chart out all that, and that's it.